if I slouch through here, if I tuck my tailbone underneath and my head comes forward, this stuff gets really, really tense and really, really tight.
Okay, let's get oriented to what we're looking at here when we're going to talk about resetting the pubic bone. I'm going to show you a few slides here in the beginning. Then we're going to cut to a video where you'll see me representing how this fascia, the connective tissue, is running. And then we'll show you how you can make a change to the pubic bone, the pubic symphysis. That's going to sit right here in the center here. If you see my mouse in red highlighted going over that. And this is a front view of the body called an anterior view of the body. And of course, you see your lumbar spine right here. And on this side of the body that looks like your left, it's actually the person's right side. That's their right ilium, and this is their left ilium. Where these come together in the center here, that's called the pubic symphysis. And back here is the sacrum. And of course, you've got your leg bones here. Now, this highlighted muscle here is just one of the inner thigh muscles that are called an adductor, ADD. That means they're going to bring the legs towards each other. And that's going to play an important part in one of the resets that we're going to show you later. Well, what can happen here is this pubic bone, this pubic symphysis right here. It could get an issue where it just doesn't move as well as it should. It can get stuck. It can shift. One can go a little bit higher than the other. It can rotate in. It can rotate out. And that happens from many things: slips, falls, imbalances in the muscles that actually attach to the bones, because the bones won't move without the muscle contraction of them, right? Childbirth can do this as well. But I call the pubic bone the guy wire anchor. So think of a guy wire as like you see the wires hanging from a suspension bridge that you drive across. That keeps it steady. And these muscles that pull on the inner thigh, sometimes they can be too tight. Sometimes they can be too loose where they don't have enough tone. One side could be more tone than the other side. And then that can torque or twist. And when you're going to lose what they call stability or control in this anchor point. And what that might mean for you is pain in the knee, pain in the back, pain in the pelvis, pain all the way up into your head or your neck. Because if you look here, this is another representation. This is your sacrum again. And then this is the pubic bone coming here. Look at these adductors that are attaching to here. And this muscle coming down in here is called your iliopsoas, or your psoas muscle. Many of you may have heard of that muscle because it can get pretty tight on people and cause pain in the low back or across the hip. And then you've got this muscle here. This is your ilium. This is called your iliacus, this muscle in here. But you have the adductor attachments. But I also want you to remember that running across this region here, okay, you've got what's called your inguinal ligament. That's the crease of the groin. There you're going to have nerves pass through there, arteries, veins, and lymphatics. So when this area has an issue, you can compromise any and all of those, which can lead to what? Pain or discomfort, chronic pain, honestly, anything that it wants to give you. So we're going to show you a way to take some pressure off of this pubic symphysis region here and try to get some movement in there. Now, if we take a look at this graphic here, this is going to be some of the work of Thomas Myers, who's a friend of mine. He's got a fantastic book called Anatomy Trains, like trains on a track. So make sure you go look up Anatomy Trains, and I would highly encourage you to purchase this book. And I've talked about the Anatomy Trains in the past on the videos that we did for our tongue circles, which has gone ballistic viral because I think it's like 500,000 views right about now. And because it's helped so many people just by moving the tongue. And that's part of this deep, what they call the deep four line. the takeaway from this is that everything in the body connects, and fascia is connective tissue. Right? I want you to take a look at that green circle. That's that pubic symphysis, pubic area that we're looking at here. Now, look, you've got all these inner thigh muscles here that running up and attached to that anchor. These are also the muscles coming from higher up that are now running down to that. And then they go all the way down to your feet. You'll see another picture in a moment, all the way up into your head, neck, and face. And represented here is your tongue. Now, what you'll also have running across this is something more superficial, which is your rectus abdominis muscle, your abdominals. And they're going to run right across here, and they're going to attach down to that region as well. So what you may find is this. If you do the resets that we're going to show you, you may notice a change in any part of your body, but particularly the reasons that you see represented here. This is where you'll go, Doc, that's the craziest thing in the world. I did that reset that you just showed me on here, and I feel better in my feet. The back of my calves feel better. My knee feels better. My thigh, my inner thigh feels better. My lower back, I'm actually breathing better. You can see your diaphragm is there. Your lungs are in there. So you maybe have better breathing capacity, less tiredness, less fatigue, more motion, more mobility. That means you're moving more efficiently because you're not as tight. And you're even going to go all the way up towards that tongue and say, Doc, I feel different in my throat. My jaw has less tension, and I have maybe less headaches. I mean, you name it. You can notice a difference with this stuff. Okay.
Let's take another look at how that fascia runs that we talked about in our prior video. I'm just going to take some elastic therapy band to represent the fascia. Okay, so down here is that pubic bone. And that fascia is going to run from the pubic bone all the way up into this region here. So you can see how posture may make a difference in that. From if I slouch through here, if I tuck my tailbone underneath my head comes forward, this stuff gets really, really tense and really, really tight. And so whenever you try to stretch it and elongate it, it's going to pull all along there, particularly at the anchor points. Okay. And now here's the inner thigh. Remember, this is where your adductor muscles sit, and they bring the legs in like this. So remember how they went from here to that pubic bone, but they also continue coming up, and it will join this line straight up. But you also have what's called these X's of fascia that go across the body. And that will go all the way over to the opposite side shoulder. So look at that mixture here. I can have my shoulder over here coming down and attaching to the inner thigh on the opposite side. Now, can you see now how if there's an issue right here, it may cause shoulder things, maybe elbow, wrist, and hand, because that line keeps going all the way down because everything is interconnected. And it can do the same thing on the opposite side of the body. And you have to keep in mind not just the front, but the back side as well. So where we're going to go is right down at the pubic bone here. So follow along with the next two resets. I'm down on the ground, and what I've done is I've taken a regular bath towel and I've folded it over itself a couple different times and rolled it up lengthwise. So you can see what that looks like here. Okay. And this is what we're going to place right on that pubic bone when we're lying face down, and we're just going to ease into it. Now, I would like to take a moment to give some props to Block Therapy, who I initially saw this move from, and they were using one of their blocks. I encourage you to check those guys out. They have a lot of good content. But this was very, very helpful for my youngest son, who was suffering some low back pain from some disc issues, and he still does it to this day. So let me show you how this works. You're going to place this right on the pubic bone. So it looks like that. Now you're going to have to play with the position here, obviously, to get right to the comfortable spot. And you're likely going to feel quite a bit of tenderness in this region when you first begin to do it. But breathe, take your time, don't rush into anything. So watch what I'm going to do here. I'm going to come here, I'm going to find that spot right on the pubic bone. And now I'm up on my elbows. Okay. And that's going to be a little bit easier at first because the lower you go down here, the more pressure you're going to feel on that pubic bone. So I'm slowly kind of walking my elbows out here. And then eventually I'll come down to where I'm just resting my forehead on my palms here. And remember to breathe. If you have to come back up again for a little bit, that's fine. And just play around with your position here of what feels best. Don't stop breathing. I know I say that a lot, but that's really, really important. And just start with 60 seconds, okay? If you can't make 60 seconds, then come back and try it again later. And what I'd like for you to try to do is to lay on this for 60-second increments, like try 60 seconds, then add 60 more seconds. So that's 2 minutes, 3 minutes, 4 minutes, right? Work up to 4 to 5 minutes and see how that feels. And you can do that a couple times a week. Just there's no magical amount, but I want you to play around with what the man, oh man, that already feels really freaking good. And now, after you do that, you're going to follow it up with this pubic bone reset. And then hopefully that'll make a big difference for you in feeling better throughout your entire body. Here's a move that you can try to reset the pelvic bone. Now, I actually encourage you to check out numerous videos on YouTube to see different variations of this reset. You'll see people doing it to someone else. You'll see different versions of how to go about resetting it. This is just one that I like, but I always encourage you to learn from different resources. Here's what you do. Find a chair, sit in it comfortably, so your legs are going to be about parallel to the ground. You can have shoes on or shoes off. It's up to you. I want you to put your feet together so they touch. You're going to have a slight separation in between your legs here. And I want you to put your hands on the outside of the knees. What you're going to do is try to abduct, move your legs away, but you're going to press in with your hands and you're going to prevent that from happening. And you're going to do that for 5 seconds. So you're going to go 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, relax. And we're going to do that a total of 3 times. So we'll go again. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000. Don't stop breathing. You should have no pain here. One more time. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000. Okay? And then after that, you're going to place your elbow here, your hand here like this. And I want you to push your legs in towards each other like this for 3 seconds. And you may hear an audible pop or feel a reset in that region right there. And that's going to be the pubic bone reset. Now, you might not feel that either, but you're definitely going to notice that you work that region regardless. Now, when you go on YouTube, you may see people with their legs a little bit further out when they press out and then they come in. Try that variation. Maybe you'll find somewhere out here that works just a little bit better for you as opposed to close. Okay. And give that a shot. Typically, you only have to do that reset once and it works quite nicely. Okay. Let us know in the comments how you like this, if it made a difference for you. Make sure you hit that subscribe button if you like our content, and please share it with others so they can get help too. Thanks for watching.